This is Nick Spork presenting our research surrounding the Cape Town, South Africa drought from 2015 to 2017. Cape Town is visible here as the gray swath on the southwesternmost tip of Africa. Cape Town is notable for having a reliance on rain catchment and reservoir systems in order to meet the freshwater needs of its population. At the same time, Cape Town is pinned against the coast by a curtain of mountains that serves to effectively sequester that rain catchment area into a very small bit of land compared to Cape Town's population and water needs. Taken together, this means that Cape Town's water supply is uniquely vulnerable to variations brought on by climate events. One such climate event is the 2015 to 2017 drought. What you're looking at here is the total tabulation of the water volumes in all of Cape Town's reservoirs combined. You can see a seasonal variation where hot, dry summers reduce the water levels, with cool, wet winters repleting them in between. As the drought sets in, you can see this downwards trending towards what was called a day zero, when Cape Town would run out of water. Now, in order to stave off that eventuality, Cape Town's government imposed a stepwise series of increasingly austere restrictions on water usage for its population. Our team took the opportunity to use this as a unique chance to quantify the effects of a climate event and correlate those with the health outcomes of a population. We chose to specifically focus on diarrhea, knowing that diarrhea has, in other contexts, been linked to changes in water availability, as well as the fact that diarrheal illness is a specific burden for the South African healthcare system. To start, we looked at incidence of diarrhea. Now, we used loperamide as a proxy measure, loperamide being also known as Imodium. It's a drug used for symptomatic control of diarrheal illness. And we used loperamide as a proxy basically due to the accessibility of electronic health records in the South African system. What you're looking at is a rolling 3-month average of loperamide dispensed from pharmacies to admitted patients in the hospitals. And this is a very busy chart, and I would encourage you to pause and follow the trends for yourself. But if I could focus on a few things here, you can see an oscillating baseline in the dark bluer lines, and that represents the pre-drought years. Then, if you move along to the red lines, you see an increasing trend towards higher levels of loperamide use in the orange lines, representing the mid-drought years. That does go back towards baseline in the light blue lines, representing the post-drought years. Again, a very busy chart, and I would encourage you to pause and follow it for yourself. But if I can sum it up for you, we can add this table here, looking at the average monthly usage of loperamide in the 2 years preceding the drought compared to the first year of the drought. We see a 68% increase. And our team took that to imply an increase in diarrheal disease incidence as the drought and the water restrictions progressed. Now, the big question for us was why? Why was there this increase in incidence of diarrheal disease? And we tried to correlate a bunch of different variables against the timeline of the drought and the water restrictions. And as I present this data here, I like to emphasize that this is not statistically significant at this point due to a lack of sufficient numbers in order to reach that significance. But one of the big correlates that we did find was length of hospital stay, with shorter hospital stays being associated with more maximal water restrictions. And we took this to hypothesize that perhaps this increase in diarrheal incidence was driven by people who were otherwise healthy and might have been on the edge and were instead encapsulated in a higher risk pool generated by this water restriction. So in closing, this is an area of ongoing research and something that should be pursued further. But it's very hard to underestimate the importance of such research, looking at a world in which such climate events will become more devastating and more frequent in the future. Thank you.